Hey, good morning. It's so great to see you all here. I'm Linda McCracken. I am a longtime member of SHSMD and so delighted to be part of this conference. So thank you all for coming to Orlando and coming to this session. So for our session today, we are here for competencies in your career, advancing as a strategist, aiming for the C-suite. I'm Linda McCracken from Accenture Health and Health and Public Service, and we are extremely proud to sponsor this track and encourage you all to learn from our terrific group of speakers.
Next, please welcome Dr. Anthony C. Stanowski, DHA, FACHE. Anthony is the President and CEO of the Commission on Accreditation of Healthcare Management Education, otherwise known as CAHME, in Rockville, Maryland. Currently, there are 98 programs in the U.S. and Canada that are accredited by CAHME.
Was formed about 50 years ago, January 1st, 1968, and was formed by 4 organizations: the American Hospital Association, the American College of Healthcare Executives, the Association of the University Programs in Healthcare Administration, and the American Public Health Association. And why it was formed is really important. It was these 4 organizations back in 1968 that said students graduating from our nation's great universities need to be prepared to lead this nation's healthcare system. And they said there's certain things that these students need to know, certain levels of competencies that they need to know, certain levels of requirements that they need to know. And what are they? And these 4 great organizations, one of which we're part of today, said, what do we need to do to get students ready and willing and ready and prepared to lead? So our mission, CAHME's mission, is core. Our mission is to advance the quality of graduate healthcare management education. That's what we're all about. We do this through 4 ways. Number 1 is we set the standards that are required for our programs. And the second one is important. It's probably more important than the first one. It's after setting those standards, helping programs to attain those standards. And then we look at those programs, and what we do once we help them attain it, we then determine that they're accredited, that they meet the standards. And then the 4th one is to inform the public that they actually met the standards. And when we do that, this creates a process. It creates a pathway to professionalism and career growth. It creates, in words of A Bridging World, it creates a bridge. It creates a bridge to professionalism. And so let's talk about that bridge for a second, and competency, and kind of use this, if you would indulge me a little bit, as a metaphor. Competency-based education has 2 main anchorage points: what you know and what you can do with what you know. And if you think about a bridge, those are the 2 key anchors that enables a bridge to stand. And how do we get students to go from what you know to what you can do with what you know? That's the process of education that we work through. Now, 2 towers or piers help support the bridge. And those towers are: what competencies do students more readily master, and what competencies do students have a harder time to master? What are the competencies that you readily master, and what are the competencies that are a little bit harder to master? Now, to get folks across the bridge, you have what's called a span. And that span has to be stronger the wider the areas that you need to traverse. So in healthcare, we know it's a pretty wide gap from one end to the other. It's a pretty big river to cross. So students need good foundational course requirements to be able to go from what they readily are able to master to what is a little bit harder to master. Now, the cable system holds the span. That main cable going across, how well are students attaining the program's competencies, are the things that CAHME is concerned about. And those are all those different measuring points that we look at across the course requirements. Now, the foundation finally bears the full weight of the bridge. and supports everything. It supports the tower, it supports the anchorage points, it supports the span, it supports everything. What are you basing the foundation on? What does CAHME base that foundation on? And that's kind of core and one of the things that we want to talk about when we look at here. Why all of this is important is we want to understand how do we advance in our career, and part of how we advance in our career is the foundation on which we're basing it on. Competencies, when you look at them, you have to think about what competencies are you developing? What standards are you looking at to advance in your career? How do those competencies help provide practice and feedback to you? And finally, what are the things that you're developing? What are the competencies that you're working with that are desirable to your employers, the folks who are paying the bill? So when you're considering a school to go to, or when you're considering, how to move in your career, don't just look for the letters after your name. Don't just look for the letters after your name. Look instead for what those letters mean, what you can do with those letters. There's a lot of programs out there that talk about, geez, you can get your MHA in 6 months. Well, I can give it to you in 5 months. Well, I can give it to you in 4.5 months. Well, is that really going to move you along? Is it going to develop those level of competencies that you need to kind of advance? If you don't demonstrate the skills that you have afterwards, the letters aren't going to mean much for you afterwards. So when you're considering a school or you're considering on advancing your education, look at some of the things that it embodies, the qualities and the competencies that are necessary for mastering healthcare management education. Look at some of the great organizations that you're involved with, CAHME as a great example. Look at what they're doing with competencies and how they're moving along. Look at the American Hospital Association, the American College of Healthcare Executives. Their commitment is a solid commitment to you and to the profession to move you along to the next stage. And I have to say, for CAHME's part, we're really proud of all of our members that have been with us and our core folks like the AHA, ACHE, and the Association of University Programs.